America's choice in home care.
Good morning. I am Mary Ellen Wilson with Visiting Angels, and I am your business development manager. We are so excited to be bringing you session 2 of our 3-part Aging Well Health and Wellness workshop. And we are bringing it to you in conjunction with Dr. Zykia LaRue. Hi, LaRue. Good morning. And Dr. LaRue is the owner of LaRue Health and Wellness. She is a licensed physical therapist, and she travels to your home to help you with all things physical therapy. So we are streaming on Facebook. Welcome to our Facebook friends. So a couple of housekeeping items. As Dr. LaRue goes through today's session, you may have questions, and that's terrific. If you are on the Zoom call, you can put your questions right in the chat or the Q&A box, whichever you prefer. If you are on Facebook, then we ask you to just put them in the comments, and we have Tiffany running things behind the scenes, and she will let us know what your questions are. All right, so at Visiting Angels, we are all about connecting with the community and bringing to you items of interest, ways for you to age in place successfully, gracefully, and safely. So that is what brings us to our Aging Well Health and Wellness workshop. So last week, we talked about strength and the importance of strength in aging well and keeping you at home for as long as possible. Today, we're going to be talking about balance. And as you can see, it's a balancing act. So, Dr. LaRue, I am going to defer to you, our professional.
Awesome. Well, thank you all so much for joining us today. I hope you guys can hear me okay. I'm really excited to talk to you guys about balance. It is something that we need to be able to move throughout our lives. So we're going to go ahead and get started. Like Mary Ellen said, please put any comments or questions or anything that you have that you'd like to say. Go ahead and put that in the chat box. All right. So let's go ahead and get started here. So balance is our ability to maintain an even distribution of our weight, right? Really feeling like we are steady on our feet. But if we don't have adequate balance, or if we do feel unsteady when we're moving around, we're going to see that manifest itself when we're moving about our homes, when we're walking around in our communities, in the grocery store, maybe going to church or to a family member's home. You're going to notice that you have unsteadiness, or you just don't feel safe when you're up on your feet and when you're walking. And so balance is a huge component of our independence. For us to be able to move around.
Actually, may I interject right there?
No, go ahead.
We have learned one of the biggest reasons for people moving to assisted living is due to a fall. And 80% of those falls occur in the home. And so it is a huge component. I agree.
Yeah, definitely. And that's something that I was going to talk about next, actually, were falls. Falls are huge. They're a huge life-changing event, especially for our older adults, because 1 in 4 adults who are 65 years of age and older experiences a fall. That's a lot. That's a lot of people. And then 1 in 5 out of the adults who are 65 years of age and older and have a fall, those falls result in a hip fracture or serious injury like head trauma.
Oh.
Yeah, so falls they can be detrimental to our overall health and wellness, to our well-being. It can set us back. Falls, like Mary Ellen said, people move into assisted livings because of falls. People may not be able to even go to assisted living. You might have to, after a fall, you go to the hospital, you go to a rehab center, and you're fighting, trying to get back to being independent, but sometimes you're not able to, and you have to move on to a different setting like assisted living or like a nursing home. And that's not something that you want to do, right? But falls are absolutely preventable, but you need to make sure that you are training properly, training your balance properly. And so there are a lot of different things or a lot of different factors that affect your balance. And we're going to talk about 4 of them today. Because like I said, balance is a key component to every movement that we make. So the top 4 areas that we're going to talk about today are strength. So if you were here for last week's session, you should have learned all about strength and really great exercises that you can start to incorporate into your daily routine, because having strong muscles allows us to have better control of our joints and of our limbs. The second thing that we're going to talk about today is mobility. How are your joints moving? We rely on the mobility of our joints to help us be able to change position if we were to be pushed off of balance, or if we were to experience unsteadiness. We need to be able to recover. But if you don't have adequate mobility in your ankles, knees, and hips, that's going to affect your ability to regain your balance. And then third is multitasking. You don't think about this too often, but walking is a complex activity and it requires us to be multitasking. And so this is important because if you're trying to walk and do something else, you may notice you feel unsteady, you feel unsafe when you're trying to do it. But that's how we live our lives, right? We walk and we talk. We walk and we put things away. We're moving around and doing things all the time. And so it's an aspect of balance that really needs to be trained so that you're safe doing it. And then the last thing we're going to talk about is being able to stand on one leg. You don't realize how much you do it throughout the day, but it is a necessary component to balance and something that we do on the regular. So we're going to go ahead and get into strength. Strength, we talked about last week, our muscle strength. How strong are your muscles? Because they control our joint movement and they help us to control our stability of our limbs when we're moving. So a good way for us, to test our strength, to see how strong we are in our lower body, is to do something that's called a 5-time sit to stand. So this is something that your healthcare professional, especially the physical therapist, will have you do, because it gives us an overall look at how strong are you in your lower body, because we rely on our lower body for balance. So this is very similar to something that we did last week with the squats, because you're basically just standing up and sitting down 5 times. But this is something that you can do at home for yourself if you're somebody who's able to stand. And so I highly suggest, if you want to do this test with us, to make sure that you're in a sturdy chair up against a wall. That way it doesn't move when you do it. Okay, so sitting on the edge of your chair, you're just going to have your arms. For this test, we're trying not to use our arms because we're looking at our legs, how strong our legs are. So what you can do is put your arms across your chest. And then what you try to do is try to stand up and sit down 5 times. So if you want to do this with me, you definitely can. We'll go ahead and do it together. So we'll stand up for one. Yeah, so hands across your chest, and you're just trying to stand up and sit down. Now for this test, if you were doing this in the clinic with your physical therapist or in home with me, I'd be timing you to see how fast you're able to do those 5.
I was just trying to go slow and steady. I didn't realize it was a timed event,
so
a timed exercise.
Yeah, so this is be timed, because what we're looking at is your functional strength, but also your power. How are you able to move your body weight in a certain amount of time? Because I'm sure some of you out there may struggle to stand up. It may take you a little longer. Last week, we talked about having to rock to do it. So this really gives us a good indication of how strong are we overall. Do we have enough muscle power? And then do we have enough muscle endurance? Were you able to do those 5 stands at all? So that gives you at home a good, indication of, okay, I struggled a little bit doing that. because research shows us that those who are able to do that test in less than 15 seconds, and this is for all older adults, 65 years of age and older, up into the 90s, if you are able to do it in 15 seconds or less, you have great strength functionally. But if it takes you a little longer to do it, that lets us know that you have some areas for improvement, and they are areas that can be improved with proper training.
And that was my next question. So if you were not able to do 5, or if it takes longer than 15 seconds, what do you do?
So hopefully you'd reach out to a healthcare professional like a physical therapist to help you, to guide you on areas that you really need help in. Because like I said, there are so many components that go into that test: your strength overall, your power, your endurance. You might even have some mobility issues in your hips or knees or ankles that are stopping you from being able to do that test faster. So having someone be able to look and say, okay, this is where the problem is coming from, and this is exactly how we're going to fix it, is beneficial. But like I said, that test is for strength. And so that lets you know that you have some work to do in the strength department, and there are some exercises that can help you. A lot of times what we like to do is we'll use the test as the treatment. And so you can help to improve your ability to do this by actually just doing it. Try it. Do the stand up and sitting down. Try to do it. Try your best to get to 5 if you weren't able to. And then try to see if you can do it faster. Challenge yourself in order to be able to do that. And I'm sure you will see improvement in your strength just by doing that. But another exercise that I think is extremely beneficial and we overlook it is the lunge. Because
we don't overlook it, we ignore it.
we ignore it.
We don't overlook. We
purposely overlook, like turn our head the other way. The lunge is a really great exercise because not only is it improving your strength of your legs, but it is challenging your balance. Yes. So if you are someone who wants to do this lunge with us, you can. I suggest having a chair or something steady like a kitchen counter or a sofa to hold on to for this. So we're going to do a traditional lunge where you have your foot, you want to have one foot in front of you, take a pretty big step forward. And you're going to be up on like the ball of your foot in the back there, okay? And what we're going to be doing is with that leg that's behind, you're going to guide yourself down to the floor. Your knee should be facing toward the floor like an elevator. So you're going down toward the floor and then up, okay? And you're going to feel this exercise in the back leg, in your glutes, and then in the front, in your quadriceps. Now, if you're not able to go down very low, it is totally fine. As long as you're attempting to do it, that's better than not attempting at all. And then as you get better, you can go lower. The goal isn't always to get your knee to the floor. The goal is to just try to get lower in the squat. That way you're putting some tension on those muscles and helping to get them stronger. I love this because you have a more narrow base of support. And having that more narrow base of support challenges your balance along with your strength when you're doing that exercise.
Yeah, it's definitely a balance challenge, I would say.
Yes. Yeah. It's definitely balance. And it's a good way for you to scale it, holding on to an object to start off with and just try it. See how low you can get while holding on. And then try to do it without holding on, maybe just your fingertips, and you can progress it from there. So really great exercise. Kill 2 birds with 1 stone, strength and balance all in one. So I hope that was helpful. Those tips there.
That's always a good one. It's so good for you. Mm-hmm. It just hurts so good.
Yeah.
Hurts so good, people. It hurts.
Right. But once you start, it just gets you going, and then you get that like exercise itch, and you just can't stop. Just want to keep going, hopefully.
Can't stop.
All right, so we talked about strength. Next, we're going to be talking about your joint mobility. So how well are your ankles, your knees, and your hips able to move? like I stated at the beginning of this, your mobility in those joints helps your body to recover from being, pushed off balance or unexpectedly thrown off balance. We rely on our ankles, our knees, and our hips to help us to realign. And if we don't have that adequate mobility in those joints, it's going to be very difficult for us to be able to recover our balance. So ways for you to test it, and I can show this in sitting first. And sitting is not going to be as effective because you're trying to go against gravity when you're doing some of these things. But just trying to lift your knee up. I'm sure many of you know a standard march. So lifting your knee up, and you can use your hands to help you. See how high you're able to bring that knee up towards your chest. Can you clear the chair? Can you get your thigh off the chair? If you can, great. How high up can you bring your leg? Can you bring your leg up towards your chest? And doing the same thing on the other side. If you notice, your knee is also going to bend when you do that. So it's a great way for you to look at your knees. Can you bend your knees? How far can you bend your knee? Is it uncomfortable? Does it feel like it gets stuck? Those are things that I want you to really try to hone in on and see, what's going on with your joint mobility, because there are things that we can do, to help you to improve your joint mobility. And if you're at home and you don't have a healthcare professional to help you, like I said before, the test can also be the treatment. So sitting in your chair and really just moving, doing this, even if you're somebody who sits down all day long, move these joints around. It's going to be great for that. You have this fluid in your joints that helps to nourish the surface of it. And if you're someone who isn't moving often, you're going to feel that stiffness more. And so if you sit, this is a great way to work on your mobility. Move that knee, move that hip up and down. And then also looking at your ankle, so can you bring your toes up towards your shin? And if you're unable to hold this position, it's okay to have your heel on the ground to do this. But like I said, it's not as effective because you are having to go against gravity. So if you don't have the strength to lift it up against gravity, that lets us know either we have an issue with how strong that muscle is, or it might be a mobility issue. So those are some quick things that you can do, and I suggest you do them if you're somebody who sits, all day long. But if you're someone who can get on the ground, a good way to do testing of your mobility of your ankles, knees, and hips. I'm going to do this with you guys here. So hopefully you can see me very well. You lay on a bed. You don't even have to be on the ground. It could just be in bed doing it. And you'd lay down. You could just slide one foot toward your bum. See how much can you bend your knee? How much are you able to bend your hip? And then try to bring your knee back towards your chest. This will give us a good indication of your hip mobility, but also your low back. How much mobility do you have in your low back? That's something that we haven't talked about before, but that's also an area that we need to have good mobility in order for us to be able to recover our balance if we were thrown off. And then the same thing for your ankle. Looking at your ankle, how far up can we move the toes toward the shin? Are you able to do like an ankle circle without any issues? Those types of things. And then another great one.
Really great stretches, by the way.
Yeah, and they're also great stretches. Yeah, so it's a great way for you to not only look at your mobility, but really stretch out your muscles. And it's a great way for you to just start your day, period. To get the joints loosened up, to stretch out those muscles. But that, like I said, it's very important. The mobility in these joints are just so important for your balance. If you don't have it, you're going to see that you may, not be able to recover your balance. Maybe you get startled by someone and you're unable to recover your balance. And what we don't want is for that to end up being a fall. Because we know, like I said earlier, 1 in 4 adults 65 years of age and older have a fall, and a large percentage of those end in fracture. So let's stop falls before they happen by testing our strength, testing our mobility, noticing if we're having issues. And if you are, seek out the people that can help you to resolve those issues. But I'm giving you some tidbits here in that using these assessments can help you to improve your mobility and your strength. So hopefully that was very helpful in the mobility aspects of things. Do you have any questions about that, Mary Ellen?
No, one thing that comes to mind though, well, I guess yes, not no, yes, I do. One thing that comes to mind is for a lot of older adults, especially if they're not drinking enough water, when they get up quickly like that, they do get a little bit dizzy.
Mhm.
So what can they do to prevent that dizziness or that lightheaded feeling when standing up quickly?
Yeah, so one thing that I would say, sometimes there are different medical conditions that can cause that as well. So if you are seeing that that is something that's perpetually happening, please talk to your physician about it. But if it's like an ever so often, you get up too fast and you feel that dizziness, one thing that I like to tell my clients and patients to do is to always try to be moving around before you do something like that. Same thing if you were to get out of bed quickly, you might feel that dizziness, right? So take your time doing those movements and take breaks in between. So if you're about to stand up, first, I hope you weren't sitting down for an extended amount of time doing nothing. But if you were, I want you to move around, because the muscle pump action, the action of your muscles contracting and relaxing, helps to get blood flowing before you start moving. So start moving your arms, especially your legs, because those are where our big muscles are located. That way we can really get that muscle pump action working. Start moving your legs a little bit before you get up. And then once you stand up, stand there for a second. Stand there for 4 seconds, 5 seconds. Make sure that you're steady on your feet before you take that first step.
Move.
But definitely suggest make sure you move before you get up if you had been sitting down for a long period of time without moving.
Great. Another question that comes to mind, we know that a majority of the falls at home occur in the bathroom.
Mhm.
So are there any tips that you could give in terms of, navigating your bathroom? I mean, it's obvious in some ways that getting up and off of the commode, you need to have strong muscles for that, or grab
Mm,
bars. But what
right.
are some other hints that you might share or tips?
Sure. So something that I would say is very similar to just trying to get up and move around in your home. Something like I said before. A lot of times, depending on what we have been doing in the bathroom, we might have been exerting force, and so then trying to get up, you might feel that lightheadedness or dizziness. So take your time in between movements. You have time, so rest, relax, and then when you're ready to stand, then try to stand. You always want to be taking your time. If you have like a smaller bathroom, or actually just if you have a bathroom, everyone should, be careful with throw rugs. Those bath mats that are on the
You need to
floor,
get rid of them. Yeah.
yeah, those bath mats on the floor are a fall hazard. We love them, but they are not great and they can lead to a fall. They're not meant to stop us from falling. They're just not made that way. And so it's really important to make sure that you have a clear line of walking or a clear line of moving around when you're in the bathroom. But making sure that you're not trying to grab onto things that are unsteady, because a lot of people they'll do is when they feel as though they may fall, they grab onto the door handle, or they'll grab onto like the washcloth holder on the wall there. They'll try to grab onto things that are not steady. They're not made to hold your body weight. So if you are someone who likes to reach for everything that you might not be able to hold on to safely, have grab bars or something installed there
Yeah.
that are made to hold on
That's
to
the
you.
key. That
Yeah.
is the key. They have to be installed
Yes.
properly. It's not like a towel rack. A towel rack,
No.
just as Dr. LaRue said, is not a grab bar, and
No.
it's really dangerous. One of the things that we do for all of our new clients is to go through the home and
Mhm.
assess from a safety lens how things are and where are their red flags.
Yes.
Scatterrugs, absolutely one of the
Yes.
biggest
Yeah.
issues. But you know what it brings to mind though. So what do we put down? Do you have a suggestion, and you may not, on our floor so that if the floor gets wet, it's not quite a slipping hazard?
Yeah, so I think that they have different types of oh goodness, different types of, I don't want to say a bath mat, but like maybe something that is longer that stretches from wall to wall that can be tacked
Mhm.
down or secured down. So that way it's not
A
moving. A lot of the,
non-slip
yeah,
surface type
yeah.
of.
So
Okay,
making sure that it covers the whole distance and not something that is like a small square that can slide out from underneath you. You want to make sure that all areas are secure.
right,
And that way you're less likely, to trip and fall over any of the edges. Or it's, like I said, they're not made to stop you from falling. They're made to absorb water. That's it.
right,
That's their main
right.
function. So trying something that's a little bit longer, maybe stretching from like the length of the bathtub, securing it down on all sides. That way you're still absorbing the water, but it's not going to cause you to fall if you step on it. It's not going to slide out
Right.
from under.
Right.
And another thing I did want to mention is lighting. Make sure that you have adequate light in the bathroom,
Yes.
especially like at night. A lot of falls happen at night because you go in there, you can't see, you're moving around, you trip over something, or you reach for something you thought was somewhere where you thought it was. So make sure you have adequate lighting, a night light, a motion light, something that's going to light up that space for you so you can see. As we get older, our vision is changing. And so it's very important that we are adapting our environment to that too.
So, such a good point. Yeah, adapting your environment to your new reality. Right. That's great.
Yeah.
We do have a comment.
Yeah.
I haven't seen too many questions yet, but we do have a comment.
Yeah.
I have been told not to stand up first, but to sit up first before putting one's feet on the ground. So, yeah, I think what she is referring to is getting out of bed.
Yes. Yeah. So, like I said before, taking your time to get up. So, sit up first, take a few seconds, make sure you have your bearings, then sitting on the edge of the bed. Because what tends to happen is our thought process is I'm trying to get out of bed. So that's what you do. You get out of bed, you put your feet on the floor and you go to move, and then you end up falling on the floor because you have that episode of dizziness or unsteadiness.
Right.
So sitting up first in bed, and then making sure you have your bearings before you move toward the edge of the bed where you could possibly fall is a great tip and a great way, to decrease that risk of falling and to make sure that you're safe when you're trying to get out of bed.
And again, it's all about taking your time. And I
Yes.
love the comment that you made. You've got the time, so take it.
Yeah. Yeah.
Um,
Take your time. No one's rushing you, hopefully.
yeah, right, right. That is so
Yeah.
true. Okay,
Yeah.
let's see what else we hear. What
Yeah.
are alternatives if a walker won't fit the width of your bathroom entrance? Ooh.
Yeah.
So
So
you're using a walker and your doorway is not large enough.
it's
What
narrow.
to do?
Yeah. So that's really tough. My first recommendation would be to always try to contact a occupational therapist. Occupational therapists are really, really, really experts in finding and helping you to adapt any type of equipment that you have to help make your home environment safe and to keep you independent. One thing that I notice happens is that the wheels on the outside of walkers are what gets caught on the doorway. But what you can do is take the front legs of the walker and turn those wheels on the inside of the walker. So
Oh,
that way
so
those wheels,
they're that flexible. You can move them right
yeah.
to the
So
side.
usually
Okay.
it's one of those like pressure pins with holes.
Mhm.
So if you push that pin down, you can slide off the leg of the walker and just turn it so that the wheels are on the inside of the walker and then put it back on. And that should help at least give you that clearance because those wheels are thick. They're about like an inch probably in thickness. So it's taking away space for you to fit your walker into the bathroom door. And so if you have someone who can help you to do that, please do that. You can switch those wheels, and it's not going to affect the way the walker works. It's going to work the same way. It's just that the wheels are going to be on the inside instead of the outside. Give you that space to clear the door.
That sounds like, yeah, that's awesome. Now, is it possible? What is the rotation of the wheels like? Is it possible to go in sideways? Will the wheels turn?
No, so that depends on what type of walker you have. And honestly, I probably wouldn't suggest it because sometimes there are like the, what are those called? In between the door. I cannot think of it right
Jam.
now. There's like a little lip there.
The jam.
Yeah, so, if you're trying to go in sideways, I would not want you to be tripping over that. Some walkers, most standard, those gray walkers don't have, the wheels don't rotate. So that wouldn't work for that. But if you have a standard gray walker, what would work is trying to turn those wheels on the inside. That should help. If you have like a rolling walker that has the 4 wheels and the seat on it, that's probably not going to work for that. You might have to look, and like I said, please contact an occupational therapist for this, but look for something that is slimmer. Make sure you measure your door width and compare that to the size of the walker if you were purchasing one. You want to make sure that it's going to be able to fit into your bathroom. If you're unable to do that, then there are definitely other ways that we can try to get you into the bathroom safely, but I highly suggest consulting with an occupational therapist.
Yeah, it definitely sounds like the wheels are the first line of attack on that.
Yeah, you can start there, definitely.
Yeah. Okay. All righty, let's see what would be an appropriate cane to use from the bathroom entrance into a bathroom to the commode. Okay, so this might also be if she puts her walker outside of the bathroom door and she has a cane, is what I'm thinking. What would be the appropriate cane? What type of cane to use from the bathroom entrance into a bathroom to the commode? So there are different types of canes. What's the best one?
Well, there are different types of canes, but there are different types of canes that are dependent upon your ability to balance. And so depending on your level of balance, you may be able to use a cane that's just your traditional cane that has a little point on the bottom with the rubber tip. If you have the balance to be able to use that, that is fine if you've been trained with it appropriately. But then there are other canes with wider bottoms that might have feet on them to help you to stabilize, because you might not have that stability to be able to use the regular single point cane. So I can't tell you specifically what's going to work for you, because you need to have an assessment of your balance to see where you're at and which one would work best for you. If you're somebody who is having some type of issue getting to the bathroom door, to the commode with the cane, you're very unsteady, I highly suggest that you speak to a occupational therapist or a physical therapist about that issue, because physical therapists especially, that's our job. We're movement experts, and so we would be able to assess your balance, see where you're at strength-wise, and make sure that you have the right device, right cane for you. But that's such a specific question. I can't give you like a here, this is the best cane to use to go to the bathroom. It's really dependent upon you and what you're able to do and how you're functioning.
Definitely. Okay. Yeah. I think that might be it for questions. Let's see. I think we got them all.
Okay, awesome.
Okay, last chance. Anyone else have any remaining questions? Tiffany, you can go ahead and let us know if there's any comments on Facebook.
No comments on Facebook.
Okay, thank you. All right. Well, I don't see any additional questions coming in. So I will say this. This has been very informative. And it seems like our Aging Well workshop is building on the ones prior. Because what I love about Dr. LaRue, aside from her knowledge base, is the fact that she's very holistic in her approach to wellness. So it's not just one thing, it's how all these different pieces play into each other. We saw today, especially, how strength and balance interact with
Mhm.
those lunges and just even getting up out of your chair. Next week, we are going to be taking a look at nutrition and our mental health.
Yeah.
And because, believe it or not, everything starts in the gut. So I'm really looking forward to that one. And we will have some fun, easy snack type recipes that you can do as well. I know that a lot of our seniors kind of forget about cooking. They just don't
Mhm.
want to anymore. I mean, I don't want to anymore. I'm an
Right.
empty nester now.
Me either.
So the last thing I want to do is cook dinner. So to have the easy go-to nutritious meals and snacks will be really important. And you will also be receiving this recording should you need it and you'll be able to send the link out to any of your friends if you would like to. And we will also send you the invitation for the next week's wellness workshop. Should you need to get in touch with Dr. LaRue, here is her information. And although she is in DC, she does travel throughout the Metro DC area. If you're interested in finding out if visiting angels might be right for you in terms of having an extra pair of hands in the home of either yourself or a loved one to help you get through your day safely, we do have 4 offices, as you can see here. Ask for me, Mary Ellen, and I would be happy to chat with you, no pressure, about our services. And finally, one more commercial. Tomorrow is our bi-monthly coffee chat. Our coffee chats are at 11 a.m. on Wednesdays, and they usually pertain to a topic regarding dementia and Alzheimer's. And tomorrow we are talking about sundowning, the sundown syndrome that many of our loved ones who are suffering with Alzheimer's and other dementias experience. So if you haven't received your invitation for that, just put it down in the chat and we'll make sure that you get that. All right. Last minute comments, Dr. LaRue, anything I forgot?
I don't think so. I think we hit on some really important points today regarding balance. And I really hope to see you guys next week for the session about nutrition and mental health.
I can't wait. All right, everyone. Thank you so much, Dr. LaRue. As
Of course.
always, a real pleasure. I do feel like I'm going to take my lunch break now and go exercise. I feel
Yay!
motivated.
Me too, actually. Get some movement in.
Once you start moving, you don't want to stop. It's just
Exactly. It's
learning.
like Pringles.
Yeah. All right, everyone. Take care. Thank you so much for joining us. We'll see you either tomorrow or next Tuesday. Bye-bye now.
Bye, everyone.